Yes, escalator, which is just like the ascending track, in which you can see that there lies so many sensations, which could be touch, pain, temperature, and pressure. They enter into your brain via first order neuron. These carry them to the second order, then towards the third order, and finally via fourth order towards your cerebral cortex, like a sky. This is the transverse section of the spinal cord that is shown the three types of ascending tracts. Number one is the dorsal column tract, which is forming medial meniscus. The other is the spinocerebellar system. The third variety is the anterolateral system, which is made up of anterior and lateral spinothalamic tracts, right? Okay, in this picture, you can see that your body is receiving various sensations through various exterior receptors or interior receptors, and they are supposed to move via the afferent pathway, and they reach into the dorsal root ganglion of your spinal nerve, and here they have got the first order neuron, right? And their central process take them into the posterior gray column, right? Now from here, the posterior gray column has got various rexed laminae. From there, the second order neuron have to get started, and then they crosses towards the midline through white commissure. Then they have to ascend upwards and reach the thalamus. From here, the third order neuron finally reaches towards the cerebral cortex, or maybe the fourth order neuron up to the sensory cortex, right? In this picture, your skin is being shown, and we have to learn a few words about the sensory receptors located in your skin. So kindly concentrate that there lies the free nerve endings that should give response to various painful stimuli and temperature change. And you can have the info through joint or tendons. These are called as proprioceptive information. Then you can observe the Meckel's disc that has to detect the light touch and pressure in a form of a superficial pressure, not very deep. Then you can observe that there lies the Pacinian corpuscles that are supposed to detect the deep pressure vibration sense, right? Then you find the Ruffini and organs that are also supposed to detect the continuous touch or pressure. And the Meissner's corpuscles are supposed to take info for 2-point discriminative touch, means very fine touch. These corpuscles are supposed to take information. Okay, but we are going to talk about today the spinothalamic tract. They are two in number, the interior spinothalamic and the lateral spinothalamic respectively, as you can see in the cut section of the spinal cord. Now we have to learn that what type of info they are carrying. The interior one is supposed to feel the or take the crude touch and pressure sensation, and the lateral spinothalamic tract is supposed to carry pain and temperature sensations, and both these run as a single pathway, right? Again, in the picture you can see that there are various fibers called the C fibers and the delta A fibers. They are supposed to take the slow pain and the fast pain and taking through the first order neurons afferent are going to enter into the dorsal horn, right? And here this is the first order neuron, and the central process is taking the info towards the posterior gray horn. And here we have to just memorize the lamina of Rex, so we have to move towards the another picture. Yeah, this is the cut section of the gray matter of the spinal cord, and you can see the lamination here, which is being shown that, yes, concentrate that we are in the dorsal spinal ganglion where pseudo-unipolar neurons are resting. Their central process is taking info towards the posterior gray column, and as you can see that the lateral spinothalamic is taking pain and temperature sensation, and anterior spinothalamic has to take the crude touch or light touch and pressure sensation, right? And you can visualize that the lamination is 1, 2, 3, 4, 5, 6, and 7 accordingly, and so on. And the number 2 is forming the substantia gelatinosa. And what else you see? That the 3-4 lamination is supposed to form the nucleus proprius, right? In the anterior spinothalamic is taking first order neuron up to the, you can see the nucleus proprius, the third and fourth lamination. And the lateral spinothalamic tract is taking info towards the substantia gelatinosa, the number 2 lamination, right? Okay, one thing should be kept in mind, that when the axons enter the spinal cord from the posterior root ganglion, what they do, they have to divide near the tip of the posterior gray column, you would say, into ascending and descending fibers. And here they travel a short distance, you would say 1 or 2 spinal segment above and downward, and in this way they form the posterolateral tract of leisure, right? In this picture again we concentrate that how pain, temperature, sensations from your right side of the body is conducted through the dorsal root ganglion and touching the substantia gelatinosa, and from here the second order neuron is supposed to take the information towards the opposite side of the body, and now it has to ascend upwards as lateral spinothalamic tract and reaches as a fibers or tract up to the thalamus, right? Now this picture is showing you the second order neuron up to the thalamus, right? And here you can see the third order neurons that are running from the thalamus up to the postcentral gyrus or sensory cortex, right? Now you can see that anterior spinothalamic is taking the crude touch, light touch or pressure sensation, and the fibers ascending upward and descending up to 1 or 2 segment of the spinal cord to form the tract of leisure, and then crossing over to the upper side of the body and ascends as second order neuron up to the thalamus, and from here third order neuron, and finally to the destination, the cerebral cortex, right? So we must know that if the anterior and lateral spinothalamic tracts are damaged by any injury or any other phenomena, we have got the contralateral loss of these 4 sensations, that is the pain, the crude touch, temperature and pressure, right? Here is the diagram showing that in the Brown-Séquard syndrome, if there is the hemisection of the spinal cord, how we get the contralateral or opposite side loss of sensations like pain and temperature, and what happens on the same side, that we see or we observe the loss of tactile sensation and proprioception, right? The blue and red color are showing respectively, right? So again get the concept that how the receptors you can mention as nociceptors taking information, and as a first order neuron they have to reach the dorsal root ganglion. From here they enter into the lamina of rest of spinal cord, and from here second order neuron they cross over and then ascends upward as a second order neuron, and in the meanwhile your spinothalamic tract being formed by these order neurons are taking information up to the thalamus and become the third order neuron to reach your cerebral cortex. So your sensations involve the cerebral cortex, especially the sensory cortex. And what else we are missing? We must mention that you have got insular cortex and the cingulate gyrus that relate to the limbic system. So these 3 cortex, the sensory cortex, the insular cortex and the cingulate cortex, do take part in the modulation of the pain perception, right? Or sensations. Oh yes, the escalator has become a little bit difficult, but no problem, we have reached up to the destination. So it's very clear that the spinothalamic tract, either lateral or anterior, they've got crossing of axon fibers in the spinal cord, and in this way your lateral half of the spinal cord is actually taking sensation from the right side of your body and vice versa, right? Okay, there is another pathological condition associated with spinothalamic tract, that is tabes dorsalis, condition being caused by a disease syphilis, causing the destruction of first order neuron. And what they do, they cause the destruction in the lower thoracic and lumbosacral segment of spinal cord, right? And clinically, patient observe pain in lower limbs and altered sensations like paresthesia, numbness, and loss of sensations in few parts of your trunk and lower limb. And in complete cord transection or complete section will lead to the loss of sensation of the light touch or crude touch, pressure, temperature, and pain from both sides of the body, right? So now we should know that your spinothalamic tract can be influenced by the following diseases like tabes dorsalis, the Brown-Sequard syndrome, and the complete cord transection, right? Another thing in mind that the lateral spinothalamic, when it reaches the medulla oblongata, it will join along with the anterior spinothalamic tract that is running along with it. They have to join the spinotectal tract, and finally they form spinal lemniscus, which is a ribbon-like bundle of fascicles. They have to terminate in the thalamus. In this cross section of spinal cord, you can observe the spinotectal tract that is running along with the ventral and the lateral spinothalamic tracts, and finally they have to form spinal lemniscus to be terminated near the thalamus, right? Now at the last, just a revision that how receptors are taking various sensations via different fibers into your dorsal spinal ganglion and then into the posterior gray horn, then take or cross over towards the other side through the white commissure and ascend as the second order neuron, and the spinothalamic pathways, they are ascending upwards up to the thalamus, and from here they have to reach the somatosensory cortex, the final destination, right?